All right, this lecture is going to be a nice short one. This is on the disorders of the vagina and the vulva area. So there's a couple different things that your chapter talks about. Most likely what you're going to see a lot of times in this area is an overgrowth of organisms. And the organisms can be anything like candidiasis, which is like a fungal infection. It can be bacterial vaginosis. You can have cytolytic vaginitis. And then also something very common is trichomonas. People that are at risk for this, people with poor nutrition, glucose levels that are uncontrolled, stress, you'll see this, pregnancy hormones, a change in the pH, individuals who are on prolonged antibiotics, females who use vaginal douching, or people sitting for long periods of time. These are all risk factors for, any type of overgrowth of organism in the vaginal area. So medication-wise, there's a lot of medications that they can actually recommend. The big one we use a lot of times is something called Flagyl. And Flagyl has a lot of different ways that it can be administered. So it can be an oral medication, which you can actually get over the counter. It could be a cream that is inserted vaginally. There are vaginal suppositories. If they're going with a vaginal suppository, it's important to teach the female that she puts the suppository in at bedtime when she's not going to be up and moving, so that the medication stays in place. And there are still some medications that you can apply, like a douche preparation, but we've really kind of gone away from those. Most of the time it's either going to be an oral, a cream, or a suppository. All right, I do want to talk about toxic shock syndrome. Toxic shock syndrome is a systemic infection that will either be Staphylococcus or Streptococcus as the invading organism. Most commonly, what you're going to see this as, it's going to be with those highly absorbent tampons. I mean, they've got various labeling of them. So they've got them for light flow, regular flow. Usually when you see like your super plus, and I think there's even an ultra category now for absorbencies, it's those highly absorbent tampons that seem to be the causative factors for toxic shock syndrome. But you also have to keep in mind that other packing can be the cause of toxic shock. So anytime you've had a surgery where they've done any type of packing in there, you have to be worried about toxic shock syndrome because of the potential for bacteria to be on that packing, especially if it's left in place for too long. So signs and symptoms of toxic shock syndrome, the patient will spike a fever, they'll have sore throat, headache, dizziness, confusion. Sometimes they'll get a redness on the palms and the soles of the feet, usually a pretty nondescript skin rash sometimes. Blisters, petechia, those are all signs of a systemic infection, and it needs to be taken very, very seriously because the patient can get septic from toxic shock syndrome and they can die from it. So it's very important that we identify people that are at risk for toxic shock and to treat it as quickly as we can. So we do a lot of teaching on prevention of toxic shock syndrome. So we teach our female patients to change their tampon every 4 hours. Okay, without fail, we want them to change every 4 hours so that we don't harbor any bacteria for any unwanted time span. We will encourage the patient to substitute with pads. We know that tampons are usually the most likely culprit for toxic shock, so we want our females to substitute with pads whenever possible. We teach hand washing because, again, this is a bacterial organism, so we want to make sure that we're doing proper hand washing. We want to caution our patients about barrier contraceptives. So anybody who still uses like diaphragms or any of the barrier devices, if they're left in place, sometimes they'll get lodged in there. That could put them at risk for toxic shock. And we want to teach the patients to report their symptoms promptly and seek medical attention when necessary. A lot of times with toxic shock, and I see this a lot with, adolescent females or young females, is we want to assess what their knowledge about toxic shock is. Okay, so we want to find out, what do you know about toxic shock? And then we can base our teaching based on what their knowledge level is at that point.